All right. Ted Naiman here, doctor, and I'm with Dr. Seeman, who just gave an amazing talk here at MHS. Dr. Seeman, can you people just okay? Sure, yeah. Ted Naiman here for Diet Doctor, and I'm with Dr. Seeman, who just gave an amazing talk here at MHS 2022. And Dr. Seeman, in case anybody out there didn't get a chance to watch your talk, your lecture, can you just tell us who you are, what you do, what you specialize, why you're here?
Thank you. So I'm an OBGYN by practice, but I do a lot of work in ketogenic therapy, nutrition therapy, and the women's health world is kind of a small world. There's not a lot of us out there using these therapies with patients. And so my talk was on metabolic applications in women's health. So we talked a lot about the role that estrogen plays with our metabolic health, the role that estrogen plays within the mitochondria, and how having excessive amounts or not enough estrogen, for instance, when we go through perimenopause and menopause, can have an impact on a woman's metabolic health during those times and years of their life.
Okay, and can you tell us a little bit about your personal background? I know that you have had a lot of life experiences that not everybody have had. Some people might recognize you from network television. You're famous for a whole bunch of stuff. Can you just tell us a little bit about that?
Yeah, so I was a previous collegiate athlete, and but then got into medicine, and my own health got away from me. So I was diagnosed with prediabetes and hypothyroidism about 5 or 6 years ago, and kind of found low carb and ketogenic diets on a very personal level, trying to fix my own health. But with my background in nutrition and exercise science, I really started to apply these concepts to my clinical work and working with patients and learning so much, from my patients through my social media. I've gotten a lot of opportunities in the last couple of years. I was on NBC Titan Games with Dwayne "The Rock" Johnson, which was awesome. And I'm a huge advocate for women and resistance training and what our bodies can do. I've got 3 little girls, so always just really trying to inspire other females out there that you can be like strong leaders. It's okay to lift weights, because another part of my presentation was just about the role that muscle and metabolic, plays in our metabolic health. One thing we can really do to protect ourselves as we age is to gain as much lean body mass in these years where we have hormones and we're physically active. So I'm super passionate about fitness. I'm super passionate about, preventative healthcare. And this is such a great place to be and connect with really like-minded people. It's honestly very refreshing and fulfilling.
Yeah, awesome. Great answer. And you said very few people focus on women in this sort of space. And my theory is because it's insanely complicated. Women have like a lot of moving parts, all the hormonal stuff. Can you just tell us what are some of the major differences when it comes to women versus men, especially looking at ketogenic and low carb diets?
Yeah. So we have to remember that women are reproductive creatures. So our nutrient sensing pathways are, constantly looking to say, is this a good time to reproduce? So in a woman who's in her years of fertility, every single day, every single week of her cycle, we're going to see different estrogen levels, different progesterone levels, and that's actually going to change her metabolic health. For instance, the first 2 weeks of the menstrual cycle, which we're seeing a lot more estrogen, we call that follicular phase. Women have great insulin sensitivity. They recover well from resistance training and high intensity exercise. Versus the second 2 weeks of the cycle, which are more progesterone dominant, we see more blood sugar instability, less recovery from high intensity exercise and resistance training. So that's the complex part about women, is every single day, every single week, you're going to have different hormone levels from the morning to the night, versus our male counterparts, which have a lot more steady state of these hormones. I mean, they do obviously have circadian rhythms associated with them too, but women are just really complex. And then that's for somebody that's actually, menstruating and ovulatory, versus a postmenopausal woman, right, who doesn't have any estrogen. And with the loss of estrogen, now we're seeing insulin resistance, increase in visceral fat, decrease in cognition. And so for these patients, do you consider something like hormone replacement therapy to help with metabolic problems or not? Or what can they do to mitigate these risks, at that point in their life? So that's what's really complex about women, is just that our hormones are a lot different, especially if you're cycling. And we need people out there that are kind of, we need to start looking at this data. And I get flooded with questions on social media, about these different topics. And I'm just so happy that we're here at MHS having the conversation about it.
Okay. So women are there. They have a daily hormone cycle, a monthly hormone cycle, a lifetime hormone cycle with perimenopause and menopause. It's like there's, I think we know why more people don't focus on women. And some of we doctors are just like, oh, women are like men but are smaller, maybe, or something like that. So I really appreciate your focus on women. I have a question. Are there a couple times when you think a ketogenic diet might not be optimal, like maybe in pregnancy or lactation or different times? Can you comment on that?
Yeah, so pregnancy and breastfeeding is obviously a very controversial topic because it's hard to study. Ethically, we can't, put patients and randomize them into these different groups. But anecdotally, I'm starting to observe that there are patients that are doing it, and just spontaneously reducing carbs, trying to reduce the risk of things like gestational diabetes. And certainly those things are super important, but obviously that's not a time in your life when you want to start, implementing new things. Implementation of a ketogenic diet can cause a lot of electrolyte disturbances, dehydration. So, you want to be making sure that you're working with a healthcare provider that's, that knows what's going on. It's not the time to start experimenting in the middle of a pregnancy or with breastfeeding. But at the same time, the current recommendations for carbohydrates in pregnancy, I think, could be a little bit liberal. Our goal is that we have not only euglycemia, but normal insulin levels, because we know hyperinsulinemia can lead to things like preeclampsia. So I think there's still a lot of work to be done in this area, and what the recommendations are and what really is most healthy for the mom and for the baby. But certainly that would be a time that you probably want to tread lightly.
Got it. Okay, that makes sense. So we know that like most Americans are, have bad body composition, bad metabolic health. We got like this like avalanche of diabetes around us. I'm sure you see that sort of thing in your practice all the time. What are like the top three things that women who come to see you, what are they doing wrong, and what could they improve? Like just the lowest hanging fruit on the tree for these people in your practice.
Yeah. Well, I think nutrition's number one because it's something that we do multiple times per day. We do it every single day. So this is like a constant opportunity for improvement. And we live in such a world of like ease and convenience foods. So immediately eliminating all processed foods from the diet, that's immediately going to take out a lot of the processed oils that are heated and oxidated. It's going to take out the flours and the sugar. So if you can just eat a real whole food diet, that's going to improve your health probably on multiple levels. The second one is resistance training. So muscle is a metabolic organ, and so many women are afraid to resistance train. They're intimidated by it, or they think they're going to look masculine or bulky. I can tell you right now that is very hard to do. And so focusing on resistance training, no matter what decade of life you're at, I think is super important. And then the third one is sleep, actually. I think sleep is, people don't realize that poor sleep, dysregulated sleep can actually, mess with your metabolic health. It can create a lot of insulin resistance. Somebody like me that knows what it's like to go deliver a baby at 2 a.m., it will mess up my satiety hormones for about 48 hours. So I think, focusing on a whole food diet, focusing on resistance training, and focusing on quality sleep are three just easy things that you can start to implement to feel better and function better and decrease your risk for disease.
Love it. Beautiful. Whole food, lift weights, get good sleep. That's awesome advice. That's beautiful. So a question: is there anything that you'd like to promote? Things that you're working on, ways people can get a hold of you or get some of your information, your knowledge?
Yeah, I'm super active on social media, so you can find me on Instagram and Facebook, Dr. Fit and Fabulous. But I'm actually working on a new book that will come out this summer that'll have a online academy associated with it, and it'll be a great place for people to consume more information on a lot of these topics.
Okay, cool. Well, you'll have to tell us what the title is at some point so I can pre-order that thing.
Yeah. It's called Hard to Kill, actually, and I'm super excited about it. It's been years in the making.
So. Awesome, cool. So you're coming out with a book, Hard to Kill. We should all pre-order it. Thank you very much. Anything else that you want to leave people with?
No, I'm just super happy to be here. I think MHS has done an amazing job of really bringing in world researchers, practicing clinicians like myself, patients. It's just a really good opportunity for us to all collaborate and, continue this conversation about metabolic health.
Awesome. Well, thank you so much for your contribution. And thank you so much for focusing on women, even though they're super complicated and nobody else gets it. And it's great to talk to you. I appreciate it. And your talk was awesome.